What's up, everybody, and welcome back to the It Matters podcast. First and foremost, if you want to show your support, don't forget to subscribe to the Facebook page to stay updated with all the content coming up. Now I'd like to tell you something about my friends at Sneaks. Sneaks is basically all about sneakers. These guys are so passionate about the quality of their products and absolutely in love with sneakers. Each pair of them has its own story and personality. However, they believe that sneakers are often the ones who actually find us and not the other way around. And this is how their story started. Do you want to keep going? Choose sneaks and make the step. What's up, everybody? Thank you so much for tuning into this episode. My conversation with Dr. Mihai Popescu resumed from the point where he relates the outcome of him trying to implement his different teaching approach. Two of the most interesting questions that you submitted will be answered as well. We will also talk about communication and its importance, especially from a medical viewpoint. Plus, you'll also find out what is the only object that he would take on a deserted island. Enjoy! You said that you wanted to have a different approach regarding the anesthesia module, right? With that, what stopped you from applying it? I mean, I think students will be thrilled with something like this. I mean, this is if you put 1,000 students at a table, an imaginary table, and ask them, what do you want? I think that 90% will tell you this. I don't know if it will work, or after, 10 courses, 15 courses, the percentage will be that high, but I think it's something that we all want and desire. Because of that, reading courses that are not courses, that are reading classes, and I think this is quite a thing.
Well, not all the students would want this. Maybe 99.99% of them. So in 1,000 students, as you said, there's that one student that wouldn't want this.
Of course.
Yeah. And this happened a couple of years ago when I tried this little experiment. And it ended up with me at the dean office and telling me that I should reconsider my unorthodox way of teaching. So this is why I was younger back then, and I liked taking risks. Probably I will do the same in the following years, but take it more slowly. A step-by-step approach in order not to create such a shock. I'm trying to think of myself in med school, what I didn't like, and not to repeat it with my students. Back then it was simple. If I didn't like a module, I didn't went to that module, so I skipped the whole module. Right. They weren't that rigorous about absences and so on. So it was easy for me, and I learned extracurricularly at home reading or in the hospital, the things that I didn't like. You know what is somehow discouraging. So I'm 23, and I have a couple of other colleagues of mine that who are also teaching assistants, who at the end of med school thought exactly like me. We had the same thoughts and the same ideas on how to make things go in the right direction. And now they are thinking exactly like their professors and are doing the things the way they were taught by their teachers, saying, okay, this is the easiest way to do it, this is the right way to do it. So it's somehow a bit of brainwashing.
Do you think that this is genuine? I mean, they truly believe that, or are just doing it for, I don't know, for their professor, for their coordinator, for someone?
No, I think after a couple of years, you convince yourself that is the right thing to do. And it's very hard to pedal against the wind.
Yeah.
It's easier to go with the flow. Probably things should be changed from a hierarchic point of view, starting with the dean and the rector and the National Law of Education. We don't have to reinvent the wheel.
Yeah.
There are some examples in the West, some med schools and so on, that can be applied to Romania. We can do things more interactive, more practical, more from a clinical point of view, simulation-based, and so on. But this is a thing for both us as the teachers and for you as the students.
Yeah.
And we should work together on this.
Yeah.
You should ask for it. You know?
Agree. We should.
To give another proper example, my residency exam. Because you're in the 6th year and many of your listeners are in the 6th year. Up until my exam, the questions were clinical based questions. There weren't just sentences that were taken from the book. So some teachers, based on that book, on those topics, made up some questions. You wouldn't find all the answers in that book, but they were clinically sound and correct, and so on. During that year, it was a huge scandal. Somebody contested the questions and said that, okay, in this question, the answer isn't found in the textbook recommended as a mandatory reading list. And neither does this question and this question and this question. And we ended up with like 10 or 15 questions, I don't remember exactly, that were cancelled because of that. In each year, somebody contests some questions that they can't be found exactly as written in the exam in the textbook. And this led up to this peculiar situation we are in, that the residency exam, it's a copy-paste exam from the textbook. So if in the textbook a comma is in the middle of the question and not in the answer on the worksheet, then that answer is wrong. So it's taken, it's a personal opinion, I really think that they take them using Word and copy-paste from a doc or a PDF version of the textbook. So things degenerated.
Yeah.
And they degenerated because of us, because of my generation that started this. So we both have to change. You as the students have to change to look at the bigger picture, to see that a grade isn't everything to you. What really matters is to learn something that you can clinically apply and that would make you a better doctor. And for us to think that we are assistant professor, senior lecturers, associated professor, and professors because of you. Because due to the fact that students exist. And many of the teachers really forgot this. That if it wasn't for the students, that some of them don't like and don't even want to see during the module, they wouldn't be professors. They would only be doctors.
Yeah. What you're saying is exactly what I talked with my previous guest, which is a researcher in the field of neurodegenerative disease, Alzheimer's disease, and he was talking about uniformity of thought or patterns in this field of research. And I think, as you're all telling me this right now, it also applies to even lower levels among students in the teaching process. And it's quite sad. I mean, thinking about what you said with that dean problem, I think students, if they really wanted to do this, they should have backed you up with this. I mean, they say, but we want this. I mean, there's no problem. And I really don't know why they oppose so much to something like this. I mean, it doesn't change a bit for them. It's not altering them in any way. I mean, why not apply a more interactive way to teaching? Because nowadays, no students, I mean, no, let's not say general, most of the students come to the courses that do not demand presence for the human interaction. Because they have books on their phones, they don't need to stay in in a hospital to learn, right? So they come for the human interaction. Why don't we put more accent on this human interaction?
Yeah, we should probably do that. There's something else that is wrong with Romania. Unfortunately, in Romania, a teacher has to be both a teacher and a doctor. Most of the time, the head of the department, clinic, a researcher, and so on. And you can't do all of these things to the best of your knowledge. So you're starting to skip some points. I mean, of course, it's best to interact with students. I think most of the teachers would love this, more interaction with students. But okay, I have a course from 8 to 10 and there's 20 people waiting for me outside my office and I have to do my rounds. There's that article that I have to write. So we're really lacking time, or we're focusing on so many different fields that we miss the big picture. Probably if you really want to improve the quality of education in the medical field in Romania, a teacher should be only that, a teacher. So he would have the necessary time to spend with both students and with residents, because the same thing that we are doing with you, students, we should be doing with our interns. I mean, courses, seminars, and so on. And we really don't have the time to do it with them. So I think this is one of the biggest problems in Romania. Yeah. If you look outside and you look at persons that are associate professor and they are quite young in their mid-40s, you will see that at best they are consultants. I mean, they only do like 1 or 2 clinical hours per day. I mean, around, and they help somebody if another doctor from their department asks them for their help. But they don't spend like 8 hours with the patients. No, the 8 hours of their program, they are dividing it between students, research, and teaching interns. I think this could be a solution for the future.
Yeah, I think so. And there are 2 questions that I picked from people asking on my Instagram account. The first one would be, do you think that hard work ensures success, both as in medical field in general and here in Romania? I mean, hard work starting from being a student, learning, attending courses, to residency and so on.
This is a very difficult question. Hard work definitely is one of the major aspects of success. Major, but not the most important. One of the most important aspects are doing something that you really, really want and putting not hard work, but your whole soul and your whole mind into that thing. And that wouldn't be work. That would be just be a pleasure. The other important key for success is knowing exactly what you want, when you want it, what you want to accomplish, and what you are willing to do.
Basically, to be self-aware for what success means to you.
Yeah. In the medical field, you have to do some sacrifices. With your free time, maybe sometimes your family comes secondary to your work and so on. Unfortunately, if you want to be successful, you have to do that. Hard work with no thinking, no motivation, and a spark of brilliance gets you nowhere. It is mandatory, but by far is not enough.
All right. So it should be context dependent.
Yeah. Context sensitive.
Okay, context sensitive, right. And the second question, it is, if you were in the position, I'm not naming the position, in a position that you were able to change something at the medical system or education, and you would be allowed to change only one thing, what would that be?
Only one thing.
Yeah.
One thing in the education and the medical system. Probably, I would like to make everybody take a day off in their workplace and just look around themselves at what's happening around them, because I really think that most of us, if not all of us, were dissociated from the reality around us. Us as doctors were dissociated from what happens with our patients. We only see personal and professional gain. and most of the doctors have become at the border of humanity. And you just have to realize that the quantity of life, it's not all that matters. It's the quality of life. And you have to see that person around you or near you, that patient or that colleague or that nurse and so on, is another person. We are becoming less and less humane. And I think that all of us need to take a break and realize that. And reset our lives and our values. If I would be in that position to do something, this is what I would like to do. How exactly, I can't tell you. I think this is the main problem with both our educational and health system. All the rest of the problems, like under finance and so on, are small things that are independent of us and that change on a regular basis. We can improve them in a moment or not. What we should improve is the way we look at our profession and the way that patients look at us. I think that most of you saw in the recent couple of months or years the complaints that appear in different media about doctors and the medical system and so on. And unfortunately, most of them are true. They are true not from a malpractice point of view, but they are true that we are becoming less humane.
We don't interact with the patient.
We don't interact with the patient. We don't inform the patient on everything we are doing and on what we expect, what's happening to that patient. And you just have to think about it. If you are a patient and you don't know anything about medicine, and you come to the hospital and everybody runs around you, there's this student that comes and keeps asking you lots of stuff. Then the attending doctor comes with 10 students and they turn you around and ask you a lot of questions and dress and undress you. After that is this nurse that comes and draws blood and mounts all of these perfusions and so on. After that there's a resident that forgot to ask you something. And at the end, after a couple of days, you leave the hospital after a very, very brief conversation of around 2 minutes with your doctor. And you are scared. Most of the time you are alone and you don't know what is happening to you. So this is one of the things that we really can make a change in. And I think that would change the system a lot. You know that in different other countries, the countries I went and I visited different hospitals, they don't have our resources. As weird as it looks, they have less resources in UK, in France, and so on.
In terms of personnel.
Not in terms of personnel, in terms of money and what they are doing. If you take a patient from Romania and he's going to the neurology department for a headache, he will get an EEG, a CT, an MRI, different blood tests and so on. If you go with a headache in France, you will be programmed for a CT after 3 months or 6 months in not an emergency. You would go home the same day with some paracetamol and some caffeine and something like that. You go after 3 months, you perform the CT. Okay, it's not conclusive. There's an opening for an MRI 2 years from now. And I saw this in the UK with coronary angioplasty. So they had patients with 80% stenosis on their coronary artery, and they programmed their patients to perform coronary interventions 2 years from now, if they were living. And the patient didn't say anything. If this would happen in Romania, if that patient wouldn't had an appointment for a CT, MRI, PCI and so on in the next 2 days,
the media will explode.
Yeah. But what differs from Romania and the Western countries is that the patients are very well informed. The doctor really spends time with them, telling them all that is happening, all that he is doing, why he is doing, what he's expecting to accomplish with that treatment and that investigation and so on. And this comforts the patient.
So you're saying that this lack of communication between doctors and patients is the source of the complaints from patients?
Yeah. And the lack of communications between students and faculty has led to the things that we see today in our educational system. Clearly, students are very disappointed about the educational system in our med school. I'm not talking about different med schools in Romania. In Carol Davila University. This should be talked with the teachers and with the dean and so on. Because if you only are have your complaints but you are telling them to nobody, then the teachers will say, okay, they are pleased with this. They like having those courses that are very stuffy and have things that are way old and that are not current and so on. If you talk to your teachers and tell them, I don't know, at the beginning at each module what you are expecting from that module, I think that 70%, 80% maybe of the teachers would change their normal pattern.
Yeah, I think it's something that should be experimented.
Yeah, but if you do not, then things will have the tendency to get worse. And at some point, the bubble will break and something not good will happen.
Yeah.
All I see is that after the residency, there's this huge rumor and this students coming on TV and saying the exam isn't correct and so on. I totally agree with you. Why don't you say that and try to change the exam now? It's mid of January. So this is the perfect time to change something and to have still the time to learn for the finals.
Yeah.
Not in June, July, August, because the time is very short and you can't change anything under 6 months.
Yeah, but it's easier to complain.
Yeah.
And it's my case too. I mean, I did nothing about this.
Try to change it, and I mean, something that I told you earlier, and hopefully the time of Magister Dixit is reaching an end. Hopefully it will end in the couple of years that will come. a new generation of teachers has the potential to develop and change things, but they need students to do that. They need students to tell them exactly what they expect, so that the teachers can change their ways accordingly. Because not all the things that you consider are good are good.
Yeah.
You know, we know from our experience that some things that we wanted during our math school would only be detrimental to our education. It's a step-by-step process, and you have to get involved. We have to get involved. We have to overcome this complex that I'm the teacher, I'm always right, you're the student. If you disagree with me, then you are wrong.
Yeah.
And we should work together to make things better for both of us.
Yeah, I think this is quite a conclusion. But stepping aside a bit from medicine, what would you do anything else but medicine? I think we talked a lot about medicine, and I'm quite curious about this.
Well, actually, I wasn't that sure that I wanted to do medicine. It was like a last minute decision. When I was in high school, I was National Olympic at both Romanian and mathematics. So I wanted to go in that direction. I love mathematics, and I love mathematics now. When I have the time, like once a month, I do a math problem and so on, just to stretch my mind. But I didn't saw myself sitting at the computer and doing things like that with informatics and so on. And I loved the Romanian language, but I didn't know what to do it. So in the second half of my 12th grade, I decided to go and have a chance at med school. And that summer I entered med school and the Faculty of Letters and the Faculty of Civil Constructions. If I wanted to, if you wanted to ask me about what I would do besides medicine, I would say reading. I would say that if I couldn't practice medicine anymore, and I have, I don't know, lots of money, so I wouldn't have to think about tomorrow, I would live the rest of my life on a deserted island and just read. It was the guilty pleasure of my life, reading books. And even now, when I'm upset because of something and I'm really, really depressed, because I do get depressed, not that often anymore, but sometimes it happens, I close my phone, I close everything, my laptop, my Facebook and so on. I go in my room or in the summer on my balcony and just read for 12-20 hours, do nothing else but just read.
What kind of books do you read?
Anything. I like Russian writers and German writers a lot. I like history books, and I like philosophy very much. And
do you have a favorite book or author?
Yeah, my favorite author is Hermann Hesse. Hermann Hesse, I actually love it. a lot, and Kant. And my favorite book. My favorite book actually is quite a childish or very stupid book. I think you've read it, I don't know, during junior school, Cireșari. I don't know why that book, any of the 5 volumes, really make my day and really boosts my enthusiasm and optimism and so on. So when I'm really upset, I take one of those books and read it from cover to cover in a single day.
All right. And do you have, I think this is quite a hobby for you, right? Reading.
Yeah.
Do you have any other hobbies?
I love sports. I practice tennis and snowboarding for a couple of years. Tennis for 10 years during general school and high school. And after that, snowboarding. I love to, during the winter time, to go to the mountains. I used to earn money by being a waiter in med school, and I saved that money so I can go to Switzerland or France for a week of snowboarding. And I love to do that. Unfortunately, I had an accident on my right leg, and I can't snowboard anymore or ski anymore.
Not at all?
No, not at all. Even now, I have an orthosis.
I understand.
So, unfortunately, the only sport that I'm doing right now is gym. I try to go to the gym every day. With limited effort because of my leg.
Yeah, for me it's quite depressing being also a snowboarder, and I don't imagine. I don't go that often now, but it would be a disaster if I couldn't snowboard at least a couple of days a year.
Yeah, I really miss it. But I didn't want to operate my leg, so I'm afraid that if I go snowboarding again, I would end up in the OR, and I really don't trust orthopedic surgeons.
Okay. What are the things that you're most grateful for?
Most grateful?
Yeah.
Well, this is a very, very tough question. First of all, I'm grateful that I had a family that offered totally freedom for me. So I didn't have those parents that, okay, what are your grades of mathematics and so on. I went on ski trips, rock concerts and so on since I was in the 7th or 8th grade. My parents actually were very busy. My mother is a pediatrician and my father was an engineer, and they actually didn't know what year I was during high school and at the faculty. So I'm grateful to them that they chose to give me that freedom. So my life was full of bumps, full of ups and downs, and I learned some difficult things starting from a very early age. And I'm grateful that I have met some people that really changed me and changed me for the better and offered me some opportunities early in my life that made me the person who I am now.
All right. And before I ask my last question, how is your day? How does your day looks like?
My day, well,
I mean, as a routine, from a routine point of view.
this is why I love anesthesiology. There's no routine in anesthesiology. I usually wake up in the morning at 6 a.m. I take my dog out, and at 7:40 I'm here at the hospital. And as I like to say, I'm staying here till the last client, till the last operation. And this varies between 2 to 8, 10 o'clock, 12 o'clock in the night. You really can't know when you're going back home. In some days I have students, in other days I have different courses and clinical scenarios with my residents. So let's say that most of the time my schedule here at the hospital ends around 6 in the evening. I go home and I go to the gym. And after that, I read something, both medical and non-medical. Take a shower, and that's my day.
Yeah. My last question for you would be, how would you like to be remembered?
How would I like to be remembered? I don't know if I want to be remembered in some special way. All that I want is to have the opportunity to help and to guide as many people as I can, as many residents and as many students, and to treat as many patients. Some of my students and my interns really hate me because I was tough on them. But that made them the doctors they are today. And even if they don't talk to me anymore, they said, "Oh, we got out of there. He won't bug us and ask us all these difficult questions about anesthesia and so on. I'm really glad that I got rid of him." But I know that they are well-educated doctors and they are appreciated wherever they are. So it doesn't matter to me if I'm remembered as a good person or not, as long as I have the opportunity to change the life of as many people as I can.
Yeah. Well, I really enjoyed our conversation, and thank you again for staying late to record that episode. I think that all the listeners will enjoy it.
Thank you very much for your invitation, and hopefully we'll hear each other again. And hopefully over some years, maybe you'll come back here in this clinic. You will look me up and tell me, when you said that students have to, look, they did and this happened. I really hope that this interview will be listened by as many people as possible. Especially young students in the first year of medical school. And I really hope that they have the urge to build something and to start something and to make a change.
You said the first year student. I had this in mind when I started the podcast, the first year student and me as a first year student. And I thought about, I think I would really love to listen to people talking to me when I'm a first year student and when I have that struggle, when I can do some things and change some things, and I hope so. I hope it will be listened by a lot of people.
Hopefully, because change is necessary. not that things are going, all things are going in a wrong direction right now, but we have to upgrade to the current needs and the current situation. And if students realize that they should be competitive, not in Romania, but worldwide, they need to start changing themselves and the med school from pre-clinic up until the residency exam, and of course during their internship.
Yeah, right. I'm really looking forward to meet you again.
Thank you very much.
Thank you.